Exercise in older adults with type 2 diabetes. Hello class, my name is Amelia McFarland. I am an FNP student at South College. I am researching the significance of performing at least 150 minutes of moderate intensity activity per week in older adults with type 2 diabetes to mitigate the risk of cardiovascular disease. The reason I chose to study this topic is due to my uncle's ongoing struggle with type 2 diabetes. For the past year, my uncle has struggled with type 2 diabetes, which led him to require kidney transplant. My father was fortunately a match, but the procedure was put on and off for over the past 8 months due to my uncle's kidney function, heart, and fluid retention. Luckily, on April 24th, the Wednesday before my birthday, my uncle successfully received my father's kidney. Both my uncle and father are doing well. I haven't seen my uncle happy and healthy in a long time, so this topic is near and dear to me. In this presentation, I will describe the significance of the practice problem, provide a summary of the search strategies utilized, provide an evaluation plan, provide the process for the proposed change utilizing the ARCC model, give a description of the setting for the planned change, and provide a synthesis of literature that supports the proposed change. The practice problem is the incidence of cardiovascular complications amongst older adults with type 2 diabetes. People with type 2 diabetes are more likely to develop and die from cardiovascular disorders such as heart attacks, strokes, and heart failure than those without diabetes. Reducing cardiovascular complications in older adults with type 2 diabetes is important due to the amount of people affected by type 2 diabetes and cardiovascular complications. The number of people affected by diabetes in the United States is extremely high and rising. The American Diabetes Association reports that the United States has about 16.5 million seniors affected by diabetes, diagnosed and undiagnosed. With new cases each year, 1.2 million Americans are diagnosed with diabetes. The CDC states diabetics are twice as likely as non-diabetics to experience a heart disease or stroke. Heart complications that have been associated with type 2 diabetes include ischemic heart disease, heart failure, stroke, coronary artery disease, and peripheral artery disease. According to the American Heart Association journals, the average cost of a hospital discharge for cardiovascular disease is $32,500 for ventricular tachycardia, ventricular fibrillation, and $33,700 for peripheral vascular disease. With the number of type 2 diabetes cases rising and the risk for cardiovascular complications present, the need for change is evident. The population concerns type 2 diabetics 45 years old and up. This designated quantitative population is selected because most people with type 2 diabetes mellitus are diagnosed between 45 and 64 years old. Another rationale for this population risk factor is the increased risk of cardiovascular complications amongst this population. In addition, as the elderly are becoming more inactive, there is a rise in prevalence of cardiovascular complications among older adults with type 2 diabetes. There are many reasons for focusing on the type 2 diabetic adult population older than 45. These include high-risk population, potential improvements, improving quality of life, and cost effectiveness. The reason the type 2 diabetic population older than 45 is high risk is because of the factors of age-related changes to the body and the patient's existing comorbidities such as diabetes and obesity. Therefore, targeting this population can help reduce cardiovascular disease burden. The proposed intervention to address cardiovascular complications in patients with type 2 diabetes over the age of 45 would be to promote at least 150 minutes of moderate intensity activity per week. Physical activity has been found to lower premature mortality in patients with diabetes and may be useful in reducing diabetes-related comorbidities. The proposed intervention was selected due to the support from evidence-based research. The CDC states that physical activity also helps regulate blood sugar levels and reduces the risk of heart disease. This intervention will be supported by evidence-based research and led by nurses. The proposed intervention will rely heavily on patient support and commitment to reducing their cardiovascular complication risk. The nurse-led intervention will require interprofessional collaboration between healthcare professionals and assistance and education provided by nurses to inform patients of the benefits of becoming active and living a healthy lifestyle. It also requires cooperation from a nurse who would help the patient develop sensible and agreeable targets and exercise short-term goals. The nurses would also inquire about any barriers preventing the patient from becoming active. The nurse will refer the patient to a dietitian who will provide the correct nutritional information for a patient with type 2 diabetes. Currently, there is a trend among older adults with type 2 diabetes, which is a reduction in physical activity. People with diabetes were shown to be 20% less active than those without diabetes, according to an objective accelerometer measurement. An inactive lifestyle can lead to an increased risk of cardiovascular complications. Physical inactivity leads to obesity, hypertension, and high cholesterol, all risk factors for cardiovascular complications. However, an active lifestyle can help reduce cardiovascular complications in older adults with type 2 diabetes. Compared with physical activity, physical inactivity leads to increased health-related problems. Regular physical activity aids in weight loss, lower hypertension, and hypercholesteremia, and improves cardiovascular health. Being active also boosts insulin sensitivity and glucose tolerance, decreasing the patient's blood glucose liability. An active lifestyle significantly minimizes cardiovascular complications for older adults with type 2 diabetes than an inactive lifestyle. The intended outcome is to reduce the cardiovascular risk complication among older adults above the age of 45 with type 2 diabetes by promoting at least 150 minutes of moderate intensity activity per week over a year. The outcomes will be measured using the Framingham score, ASCVD, risk score, relative risk calculation, and results from evidence-based research will be reviewed. The search strategy utilized CINAHL to collect research. Terms utilized to conduct this search included cardiovascular disease, CVD, heart, cardiac, coronary heart disease, diabetes type 2, diabetes mellitus type 2, diabetes 2, and exercise or fitness, and physical activity. The filters added to this search included full text, publication date from 2019 to 2024, English language, and a geographical subset of the United States, and peer-reviewed. This search led to 63 search results. 9 of the studies were not relevant to the PICO question. 2 of the studies utilized participants who needed to meet the age range of the PICO question. 3 pieces of research were applied to the intervention. 4 more were found through reviewing the references of the 3 pieces of research. A total of 7 researchers were collected. Older and multimorbid persons with type 2 diabetes have a higher risk of cardiovascular disease and chronic kidney disease. Physical inactivity has been shown to cause 1/3 of both type 2 and ischemic heart disease. Cardiovascular complications and mean blood glucose levels are reduced among older adults with type 2 diabetes when physical activity takes place. Studies have shown that physical activity reduces mean blood glucose levels and risk for cardiovascular complications. Exercise has been related to gains in physical fitness, a reduction in numerous cardiovascular risks, and reduction in mean blood glucose levels for persons with type 2 diabetes and those at risk of developing it. The nurse leading the proposed intervention should educate and promote the intervention amongst adults over the age of 45 with type 2 diabetes. The nurse should visit local public health facilities and educate each person about the importance of performing at least 150 minutes of moderate intense physical activity. The nurse would then aid in helping this population reach the physical activity goal proposed. The nurse must educate, support, and plan how each person will achieve the physical activity goal. The nurse will also measure the outcomes of the implemented intervention by utilizing the Framingham risk score, ASCVD risk score, and relative risk calculation. After the results from the implemented intervention are received based on the feedback, the intervention can be expanded and become a system-wide application with support from its evidence in hopes of continuing to produce quality results and outcomes through the use of the ARCC model. The planned data collection tools that will be utilized will include Framingham score, ASCVD risk score, relative risk calculation. All of these will be evaluated within a year of the proposed intervention. The types of data produced by the tools utilized include Framingham score analyzes the risk of CAD over a 10-year period. The FRS takes into account 6 coronary risk factors such as age, gender, total cholesterol, high-density lipoprotein cholesterol, smoking behaviors, and systolic blood pressure. The ASCVD risk score. This tool estimates the likelihood of a person aged 40 to 79 acquiring heart disease within the following 10 years. The relative risk calculation. A risk ratio, also known as relative risk, compares the risk of a health event, such as illness, injury, risk factors, or death, for one group to that of another. It accomplishes this by dividing the danger, incidence, proportion, attack rate of group 1 by that of group 2. Framingham score. The Framingham score revealed the median CVD risk in middle-aged and elderly patients with type 2 diabetes was an 8. ASCVD risk score. An increase in accelerometry measured physical activity per 100 metabolic equivalent minutes per week from baseline to current in adults with overweight/obesity and type 2 diabetes was linked with a 5 to 10% reduction in risk from main and secondary CVD events at year 4. Relative risk calculation. Physical activity in diabetic individuals may lower CVD mortality. The summary risk ratio for CVD events was 0.65. A high degree of physical activity was linked with a 16% lower relative risk of CVD. The relative risk ratio between increasing physical activity by 10 metabolic equivalent hours per week and the risk of CVD was 0.9. In conclusion, promoting at least 150 minutes of moderate intensity activity per week in an active lifestyle among older adults with type 2 diabetes is essential in reducing cardiovascular complications. This issue plays not only patients but also their families. The intervention is evidence-based, supported, and nurse-led, with collaboration from many healthcare professionals. The current trend shows a reduction in physical activity among this population, leading to cardiovascular complications that exemplify the need for support. The research collected highlights the growing problem and necessity for change to stop the increase in cardiovascular complications and in return improve the patient's health.